Hello and welcome to Downriver Rescue Connection. I'm your host, Patty Radikovich, and it's my pleasure to bring you information on animal-related topics in the animal rescue community. On today's episode, our guest is Dr. Monica Turenne, and she drove all the way from Ann Arbor in a torrential downpour to be here, so we want to thank you so much for sticking with it and navigating the roads to get here this evening.
Well, thank you for having me, Patty.
And some of you may remember, we actually did a short clip with Dr. Turenne about a year ago when we filmed at the Ann Arbor Pet Fest. She had talked about the integrative medicine and acupuncture, and today she brought with her her own dog, which is Darwin, and Darwin's a therapy dog as well, correct?
Yes, he is. Yep.
So, Dr. Turenne, like I just said, you are you're an integrative veterinarian, and I'll have you explain, what that is. You're also a certified veterinary acupuncturist.
Yes.
And your clinic is, you're a mobile veterinarian, which is a little bit different. So you go to people's homes and you see them inside their home instead of seeing them in an office. So can you tell people, first of all, what is an integrative veterinarian?
So it can mean something a little bit different for every type of integrative veterinarian, but generally speaking, what it means is that you do something more than just Western medicine. So you do some type of holistic medicine. For me, what it means is that I do acupuncture, and I also do Chinese herbal therapy as well. In conjunction with that, I do other modalities as well. I do a little bit of glandular therapy. I also do other Western herbal supplements, as well as some muscle testing, and a few other modalities as well.
Okay, great. So now as a mobile vet, and when you get into people's homes, it actually allowed you to get into animal hospice, which really is the topic of our show this evening. Yeah. So before we get to that, talk a little bit about what is a mobile vet.
So a mobile vet is somebody who actually, instead of having pets come to, or having clients go to the veterinary office in a building, the veterinarian actually comes to you instead. So we actually go to the home to visit the animal. So it's a little bit different.
Right, and so this allows you to have a more in-depth consultation.
Very much so. Right. Very much so. We're able to actually see the animal in their own environment, which is helpful for a lot of reasons. It's helpful in order to help with diagnostics. So if there's behavioral problems, you can actually see the animal and see what's happening. If, for example, if a cat is urinating outside the litter box, you can see what are the stressors in the home that could be causing that. You can also have the animal be a lot more calm in the environment. So if a pet is really upset about going to the veterinary office, it's very difficult to examine a pet when they're so upset in the office. Well, in the home, they're a lot more calm. It's a lot easier for everybody, the client, the pet, and the veterinarian.
Right. And I know when I was talking to you, you said one of the things that being a mobile vet has allowed you to do is to actually help people with animal hospice and with end-of-life decision for their pets. So we've already, on this show, we've talked about our rescue has an animal hospice, so we've talked a little bit about it. But can you explain to the audience what is animal hospice?
So animal hospice is essentially an option for people that are not ready to euthanize their pet, or if the pet is not ready to die in a natural way yet. So, for example, if your pet has been diagnosed with cancer and you are not ready to euthanize that pet yet, and your pet is not in severe stress, is not in a situation that they're very painful, where we can actually allow your pet to be comfortable and not be in a situation that that is dire. So we're allowing them to be in a comfortable way, and you can bring them home, you can be with them, you can actually allow them to be with you for a period of time before you're ready to euthanize them and before they actually can die in a natural way. So it allows you options other than euthanasia or having to make a decision that is made under a stressful situation. So if it's just been a cancer diagnosis or just been a kidney failure diagnosis, it allows you those options.
Okay, great. And I think that's one of the things that people don't realize is sometimes somebody will take their animal in and it could be an animal that's 15-year-old cat or something, and they're told, okay, the animal has cancer. And unfortunately, sometimes they're advised just well, there's not much to do, the animal's 15, so let's just go ahead and euthanize the animal today.
Right.
And what you're saying is this allows them an option to say, well, let's assess the whole animal first of all, see what their quality of life is, and is this something that it's not necessarily treating the cancer, but it's allowing the animal to still have a good quality of life until it gets to a point where you need to make that decision.
Exactly right. Yeah, we don't necessarily cure anything. We're just doing palliative care, just really making sure that the animal is comfortable and free of pain, but living a quality of life.
Right. And then just to point out to people too, is there are, obviously if your animal is diagnosed with cancer, there are options for treatments.
Oh, it's absolutely.
Those options are maybe not available to everybody. It could be because of cost, it could be due to the age of the animal, or it could be people's personal beliefs. So this just allows you another option. Although we want to, I just want to point that out as, yes, just because an animal gets that diagnosis does not mean that automatically they have to be put into hospice. There are other options for treatment, and this is when you feel that those treatment options would not be in the best interest of pets, this is another option.
Right. And I will say that that's what led me to hospice, because I felt very frustrated when I was giving a client a diagnosis that was a terminal diagnosis or a life-threatening diagnosis, and the options were either euthanasia or spending a lot of money. And owners felt and clients felt very, very stuck, and they didn't know what to do. And I always felt like there had to be something in the middle. There had to be some kind of in-between, and I was very frustrated by that. And when I found hospice and I heard about animal hospice, it was like this light bulb went off, and I said this was exactly what I was looking for, the in-between for these patients. Something else that we can do when owners cannot do exactly what you just said. They're not able to or don't want to spend thousands of dollars on care or a cure, if there is one even available, but they're not ready to euthanize yet. So it's exactly right.
Right. And then some of these too, and it's not just things like cancer, I mean it could be kidney disease, heart disease, but also a lot of times people will come in and they have an elderly dog that has severe arthritis and the dog is in pain.
Right.
And all they've known about from the past is perhaps other pain treatment options that weren't always as friendly, to the animal, not because it can cause other issues. And so this is a way to say, okay, let's look and see what other options there are too.
Right.
So that you don't have to say, well, today is the day, but your animal is not on any pain medicine.
Yes, absolutely. I mean, animals that are at the end of their life that have life-altering diagnoses, which could be arthritis, they absolutely deserve hospice as well when the time comes. And there are so many things that we can do for those patients, and unfortunately, a lot of times it's not done. And I countless times am euthanizing. Unfortunately, as a mobile vet, I euthanize a lot of patients who I don't know the client until it's time to do euthanasia. And it is unfortunate, but many times I do euthanize a lot of animals who it's too late to do anything. And if those owners had known about hospice, then they would have done something different. And so yeah, absolutely, it can be used for many things that aren't necessarily terminal diseases, but life-altering diseases like arthritis. Right,
and like so, for example, like in our hospice, obviously we have had animals that have had cancer, but we have animals that have heart disease and kidney disease, which they could live for many, many years. They may not. There are some that, maybe their IBD is so severe that, that's another issue. And then there are some that's just, they're such an advanced age that you kind of, it's like, well, they're doing okay for their age, but maybe they're 20 years old. And, and it's, so we deem them hospice animals.
Yeah, absolutely. Lots and lots of animals that are just at the end of their natural life that, a lot of times get euthanized because they're old. And age is not necessarily a disease. So those animals also deserve that kind of care.
So can you explain how is hospice for animals different than hospice for humans? Because a lot of times people hear the word hospice and they think the human definition where if you're getting hospice care, you only have a year. It's this, there's a deadline and it has to be within a year, and people come into the home and help with that. So how is animal hospice different than human hospice?
There are some similarities and some differences, but in terms of differences, I would say probably the biggest difference that I've witnessed anyway is exactly what you've talked about, is the timing. There really is no time frame that's put on hospice for animals at all. I have patients that have been in hospice for literally one day. I have other patients who've been in hospice for years, and so there is no time frame for, you know, if they're in hospice for 6 months, then they get out of hospice. That just doesn't happen. They're put into hospice, and the owners then they take care of them. They, you know, care for them. They do whatever they need for them. But there is no sort of in and out of hospice. It's sort of, you know, if you're in hospice, then you just continue on in hospice, and you get the care you need from both the owners and the veterinarian for as long as is necessary. And it's not a bad, you know, I want to say bad term to be put in hospice. It's actually sort of a good thing. Because it means that you're going to get the quality care that the pet needs. And so that's, I'd say, in my experience anyway, that seems to be the biggest difference. Another difference is that we don't not treat things. So if there is a problem that comes up, you are going to treat it. So, for example, we talked the other day about you know, patients that have upper respiratory infections that may be sort of secondary to their illness or maybe separate from their illness. We'll treat that. That is something that gets treated. I had another patient recently who has just horrific arthritis, and she developed a little lump on her foot. And, you know, I don't know how that would be dealt with in a human hospice. I'm not 100% sure of that. But in animal hospice, that little lump on her foot was causing her a lot of problems, and we didn't not deal with it. She went and had surgery to have it removed because it was causing her a problem. It was causing her pain. So it was a palliative surgery. It wasn't a cure. We didn't biopsy it. It wasn't completely removed. We just did what we needed to in order to make her comfortable. So it was a palliative surgery. So I think that that's, you know, definitely one thing that I would say that could be a difference between that and human hospice.
Okay, great. And that's something that I think people don't understand, and they really need to understand about hospice is hospice does not equal no treatment.
Exactly.
It's you're not treating to cure the underlying condition, the reason why they're in hospice in the first place. You're doing what you can to make the animal comfortable and to give them a good quality of life, but you're also treating any other conditions that come up in the meantime, if they're treatable.
Right, and many times it's interesting because many times we actually will find ourselves, and I'm talking to a client, and we'll realize we've been doing hospice. You know, we've just been doing regular medicine and alternative medicine sometimes, but many times we realize we've been doing hospice for the last 6 months. So.
Right. So now some of the things that you had mentioned in this, and I had mentioned that you do end-of-life consultations, and you had mentioned a few times in the program about, you know, euthanasia versus natural death. Can you expand upon that a little bit and talk about that and how you help somebody counsel a decision on what's right for them and their animal?
Yeah, that's a big one, a really big one. But yeah, I do a lot of consultations with owners trying to help them decide what is right for them. The end-of-life decision takes into a lot of different factors. You have to take into consideration, you know, the work life of the owner, what is their capability, not just financially, but also emotionally. There's a lot to take into that consideration as well. And the biggest difference, I would say, between deciding about euthanasia and natural death is the ability of the owner to be present with the pet. And so I counsel owners about that, and we talk about, you know, what is your ability to do that. Some owners are very able to do that and can be present a lot, can be there, they're able to take time off work, or perhaps they don't work outside the home, and so they're able to be there with their pet. And so we talk a lot about that. We talk a lot about what that means in terms of the bond, and we talk a lot whether that actually makes sense for the pet too. Is the pet suffering? Is there pain? Is there quality of life? You know, what is it that makes sense for the pet? So there's a lot that goes into that decision making, and so I spend a lot of time talking to owners about that if they're interested in that. Some owners aren't interested in natural natural death at all, in which case we don't. So for some people, that's not even really something they want to talk about. But I think more and more, I like to make sure people know that that is an option, which is not something that really has been on the forefront of clients' minds. Really, I think euthanasia has been something that we've always thought we had to do, but it's not necessarily the case. Sometimes natural death is an option.
Okay. And then something you had said in there too, and we had talked about this the other day, was one of the questions we get asked a lot from people when they find out we do hospice. They're like, how can you do this emotionally? Like, or how could you be with the animal at the time of death? Because to them it's very difficult to do that, and they can't imagine themselves doing that. But we try to, we explain our rationale why we do that. But what do you tell a client that says, I'm really not sure if I want to be there. I don't know if I can handle it. So what's the advice that you give?
Well, the first thing I would do is to prepare them. I think preparation is probably the number one thing we need to do, is to prepare them for what is it like, because that's a really big question people always ask me, is what is it like? And so I try to prepare them, if they've never been through it, as to what do I do, what exactly is the process. So that's really the first thing that I do, is to tell them what is it going to be like. And a lot of times once you explain it to them, then they understand, and it's easier because they know what to expect. But the other thing that I really try to counsel people about is that, I'm walking in off the street, essentially, usually. I might know these people for a little while, but most of the time I don't know them very well, or I know them just a little bit. And so I don't know the pet. So they obviously have spent years and years with this pet, and so I always try to have them understand that this is the last gift that they can give their pet, and if they can find it in their heart and find it in their gut, essentially, to spend that last moment with them, this is a gift that they can give them. And so they will never regret, ever regret being there, but I've had plenty of owners tell me afterwards that they regret not being there. Never had anybody regret being there. So if they can find it within themselves to do that, then they usually don't regret it.
Okay, great. Yeah. It's great advice to give to people.
Yeah.
So can you give us an example of one of your hospice patients? Like the whole process of how it kind of started and then what happened? Sure,
absolutely. I have many cases. Probably the one that sticks out the most right now anyway is this lovely Great Dane, and he developed a tumor in his leg, and he had gone to the veterinarian, and the veterinarian had recommended euthanasia immediately, and the owner didn't want to do that, so she took him home, but clearly the dog was in a lot of pain. And so she called the veterinary office, and she said, I want to do something else. I don't know what to do, but I want to do something else. The receptionist at that hospital was wonderful to her and started looking for something. And she found hospice, and she found me. So I went and I helped these people. And unfortunately, this tumor got very, very large. It grew to about the size of a small melon on his leg. But he was pain-free the entire time. He gradually stopped eating. He got kind of nauseous, but I helped him along the way. We helped with anti-nausea medications. We helped with, getting his appetite well. He was completely pain-free that time. We made sure that I suppose I shouldn't say that I wasn't him, but he seemed like he was very, comfortable. He walked well. He seemed like himself. He liked to do things. He interacted with the family. He was a happy dog. And he lived for about 3 or 4 more months. And the owners were so grateful for the time that they had with him. And he did end up dying naturally. That wasn't what the plan was, but he did end up doing that on his own. And he did it in a way that was what he wanted. That was what he ended up needing. So, but it was something that was just amazing, because it wasn't what was initially started, and because this owner realized that she needed something different, we were able to get together, and it actually turned out to be a really good thing for this dog. It was wonderful.
Yeah, and that reminds me of my dog that actually had started me kind of in hospice. Really, he was my first official hospice dog. He was a Great Dane Mastiff mixer. He was a 150-pound dog, and he was older. He was like 8 years old. I adopted him from a rescue group, and he had a bump on his leg, which they had biopsied, and unfortunately it wasn't done correctly, and it was missed. But they had said it was it was nothing. You could tell he was limping around, and
Right.
I knew there was something wrong with the
Right.
dog, and I couldn't in good conscience leave him there. So I adopted him from this facility, and I walked him right into my vet's office. And the moment they looked at him, they're like, he has bone cancer,
Yeah.
just by looking at his leg.
Right.
And I was like, but they did all these tests, and so we redid the tests, and it turned out that yes, he did. And
was.
at his age, you know, they don't have that big of a lifespan, and
Right.
you can't do an amputation in an
Right.
old dog at
Right.
that size. So we had started down some paths of doing palliative care for him, and they had actually were predicting that, you know, 2 weeks was all I was going to get out of him. And here's a dog that I just adopted, and now I
Right.
find out that, okay, he's got cancer, he's dying, and,
Right.
and it's only going to be 2 weeks. But we did a lot of different alternative therapies with him that
Yep.
helped him to be pain-free, because when I got him, he was in a lot of pain. Every time he walked, he was in a lot of pain. And we did so many different
Yep.
therapies with him. He was happy. He got to the point where he was actually running. You know, it was things too. I modified part of my home. Like I had a ramp that I had to put over the stairs so he could get up and down
Yep.
easily. And you know, he lived for about 5 months.
Yep.
But those were a good 5 months that I don't know what happened to him in his life beforehand. But when he was found by the rescue, he had heartworm, and so they treated him and got him ready for adoption, just to find out he had cancer. And at least, you know, I was able to give him those 5 months, and
Right.
he was. You know, I don't ever regret having him or taking him,
Right.
and that was my first experience with real hospice for
Yeah.
animals.
Yeah.
And so it's you know, if you can do that, it's a wonderful thing for the animal. And I look at it as, you know, what gifts did he bring me? Like
In
what did
those
he
5
bring
months.
into, you know, but in
Yeah.
those 5 months, what did he bring into my life? And it was a lot.
Yeah,
So
that's exactly right. Yeah,
Yeah.
that's exactly right. And the thing about being a hospice veterinarian that I think makes such a big difference for clients is that, you know, I'm available to them, you know, so often, you know, by email, by phone. I mean, it's once I become their veterinarian as a hospice veterinarian, you know, I'm available so much to them. I mean, I've done euthanasias at 3 o'clock in the morning. I've done, you know, make phone calls 2 in the morning, you know, whatever time it is, I'm available for them, because I know that that's how it works. It's not, you know, these things can't be scheduled, these things aren't planned, you know, things just happen. And when somebody needs, you know, help and they need guidance, then that's when you need it.
Right.
And so that's the other thing that, you know, I think it's important to know is sort of something that a hospice veterinarian does.
that's
So,
great.
Yeah.
That's great. So is there anything else that you want to make sure people know about animal hospice?
I think the biggest thing that I would like people to know is to ask your veterinarian, to talk to your veterinarian about animal hospice. I think if you have a pet that is in our situations that we've talked about, either terminal, life-altering, or just in a geriatric situation, you know, don't give up. Don't think that this is it, that there's nothing else that you can do. Talk to your vet about animal hospice. There are lots of us out there, and it's becoming a much more emerging field. There are more and more people out there that are doing this. So talk to your veterinarian about it. If your veterinarian wants more information, obviously we'll talk about that. But you know, there are so many resources online for animal hospice. There's a lot of information on how to get it, and you know, I think your veterinarian will probably be very happy to help you with that. You know, but the biggest thing is just ask. Don't be afraid to ask. I think that's the biggest thing that I think I'd like people to know, is to just ask for help.
Yeah, and I think a lot of people too don't realize that, you know, vets actually do consult each other.
Yes,
they're not.
we
it's
do.
not necessarily that you guys are all
We
in
do.
competition
No,
with each other.
not at all.
So
Not at
if there's
all.
somebody, you know, that's watching the show that their vet doesn't know about it, your information is up on the show. Their vet can contact you, and you know, you
Yeah.
can help them out with
Absolutely,
that.
absolutely.
So now. For your dog, now you said he's a therapy dog. We had a show on therapy dogs, but what does he help you to do? Does he help you with people? Does he help you with animals? Does he?
He helps me with people. Sorry,
Okay.
with people. Yeah. He goes with me, and we do hospice. So he goes into actually human hospice facilities, and he lights up the lives of people that are in hospice. Yeah.
Yeah, and that's something that too. It's like we've done that with some of our hospice animals where. We don't make them official therapy animals, but sometimes people can relate because a lot of the hospice animals have chronic illnesses. If somebody else has a chronic illness, they relate better. So people, if their animals are well enough, could actually, you know, make them into therapy animals.
Right.
Because that way you're not just, you're taking an animal in for the people to see, but they can relate to the animal too.
Yes.
And that's sometimes a huge deal for a person to be able to,
very
they can't
big.
connect with other people because nobody else understands it. But hey, this animal has the same thing that's going on that I do.
Exactly.
And so that's something that
Yes.
people could
Very
find
much
out
so.
about.
Yeah, yeah, yeah.
So can you talk a little bit, how does the integrative part of your practice, how does that really fit into helping with hospice?
Oh my gosh, it helps so much. You talked about your pet and what you had done with your pet with alternative therapies, and I use acupuncture so much with my hospice patients. It's almost sort of second nature. I don't really even think about it, but I use it all the time with pain management and nausea, appetite stimulation. I mean, those types of things, and it's such a nice thing to be able to utilize because with those patients, I don't have to use drugs. I am able to utilize the acupuncture in order to elicit those responses, which is really nice because a lot of times those patients aren't eating, so they can't take medications. So I'm able to get the response that I want just from using acupuncture, which is really, really great. So I'd say 95% of my patients that are in hospice are getting acupuncture.
That's wonderful.
Yeah.
Well, we are just about out of time, so I want to thank you so much for coming out and being on the show today and talking about this sensitive topic, because I think it's something people, really want some information about, and sometimes they're afraid to ask, so hopefully they can get that information from here. So we all look forward to a day where all pets are treated like family and everyone has a home. Until that time, we invite you to be part of the solution. And remember, please spay and neuter your pets. See you next time.